Hi, everybody. Welcome to December's Kentucky Governor's Office of Early Childhood webinar series. Today we will have the Executive Director of the Governor's Office of Early Childhood, Terry Tolan, and Tal Curry, the Program Administrator in the Department for Public Health, talking to us about strengthening families framework. So we're really excited about some of the initiatives that are going to be coming down the pike, and so that's what we're going to be talking about today. And with that, I will turn it over to Terry.
Thanks, Amanda, and thanks so much for sharing your time with us today. Tal and I are excited to have this opportunity to talk about the aspirational work that's going on in Kentucky to integrate the Strengthening Families framework across programs and initiatives that work with families of our young children. I know that this is a familiar graphic to most of you. We developed it in 2011 to explain our approach to enhancing early childhood development and kindergarten readiness. It recognizes that families are at the heart of this work as the child's most important, earliest teacher. As our Advisory Council Chair, Rick Hulefeld, has often said, somewhat more colorfully than this, actually, if I'm a kid and I have to choose between attending a high-quality program and having a great family, I would choose the great family every time. The Strengthening Families framework just acknowledges the crucial importance of helping families support the developmental needs of their child. So taking it to the next level, we might expand our intermediate outcome to say that families understand and have the skills to address their child's health and developmental needs. In other words, strong children thrive in strong families. Note that the Strengthening Families framework was developed by the Center for the Study of Social Policy in Washington, D.C., a think tank. The framework was built based on an exhaustive review of the research literature focused on child abuse prevention. It has some really solid evidence behind it. It identifies 5 protective factors that, when present and robust in families, help prevent child abuse and neglect, as well as supporting a child's optimal healthy growth and development. A very important point in these 5 protective factors are they're important not just for the families who might be considered at risk, whether that's at risk of child abuse or for some other reason, but they are important for the healthy development of all families. Strengthening Families is an integral part of the work of the Center for the Study of Social Policy. CECC uses a unified theory of change that applies to all its work. Thriving families and children is the mission. We believe this is achieved by building protective factors, reducing risks for families, and creating opportunities. Our role is building capacity to do these things through community change, systems change, and policy change. In October, Dr. Ruth Ann Shepard did a presentation on adverse childhood experiences that result in toxic stress. She emphasized that loving relationships with caring adults are the antidote for toxic stress. Building protective factors is one way that we can help families cope and help their children thrive. In most states that have adopted Strengthening Families, it may start in one program or department, but over time often will integrate other aspects of their work as well. In Kentucky, we really want to do the integration from the very beginning. These on the screen are all national partners that are working to bring Strengthening Families to their constituents. In addition, there are 32 states in the Strengthening Families National Network, now including Kentucky. We're looking at what others are doing and adopting the best practices that we find. At the state level, this works well when done in partnership with many agencies, and I'll show you who those Kentucky partners are shortly. So, how did we get here with Strengthening Families? I was exposed to this framework as a member of the Early Childhood Advisory Council's STARS work group several months ago. We had a presentation from 4C for Children in Northern Kentucky about their work with implementing the Strengthening Families framework in Ohio. Their efforts are solely focused on child care, but I was very excited about what I heard and felt that the potential of the framework could go way beyond child care or the quality rating system, although I did love the way they used it in that setting too. Shortly after that, I connected with Dr. Ruth Ann Shepard and excitedly told her about the discovery. She had just come from a national meeting where the discussion was about toxic stress and protective factors in that context. And she came back with the same shared sense of excitement about the potential for strengthening families in Kentucky. And voila, we called it spontaneous combustion. We both got there from different directions at the same time. But in any case, we were excited and we just couldn't wait to get started. So earlier this past year, we convened a diverse group of public and private partners to explore their interest in strengthening families and to talk about how we might proceed. To our delight and amazement, they were just as excited about the Strengthening Families framework as we were. So we've spent most of the year looking for an instruction book of sorts that would tell us how to proceed. Tal and his colleague Diana Coons have done all the legwork, and we've learned that there are models for implementation for many different types of programs, chiefly among them child care, but also child protective services, the National Help Me Grow movement, home visiting, and others. But in fact, there were very few states that have implemented across all programs in a coordinated way. And finally, in the Race to the Top Early Learning Challenge proposal, the emphasis on family engagement gave us an opportunity to bring some additional resources to work to help us implement in Kentucky. But more importantly, it gave us a way to flesh out a plan and timeline for implementation. So we're well on our way. The protective factors provide a common framework for collaboration. It's almost a natural. It's strengths-based, which is very exciting. It's intentional. It takes a very purposeful approach, and it's focused squarely on families and their needs, and is designed to promote optimal development of young children by strengthening their families. It goes beyond child care, as I've mentioned, because strengthening families approach can benefit all families. It really helps them to build on their strengths as a family, to buffer their risk, and to promote better outcomes for the kids. And it builds on and can be integrated into existing programs and strategies and systems and community opportunities. We have a large number of partners who make up the leadership group in Kentucky, and you'll see them on the screen, with the protective factors in the middle of the screen. And you'll see that we have many partners both in state government and, as you see on the lower right, also community-based organizations like the Pritchard Committee, Metro United Way, Children's Inc., and others who have embraced this work going forward. So Tal is going to tell you now more about strengthening families and how the 5 domains worked.
Terry, thank you so much. My name is Tal Curry, and I work with the Cabinet for Health and Family Services in the Department for Public Health and the Maternal and Child Division, and I'm very excited to be with you today. As Terry had mentioned, this was an effort, an initiative that has been created and started really through the hard work of Terry Tolan and Dr. Ruth Ann Shepard, and we're in the initial planning stages of this initiative. So as we look at this, I have this slide up here, Strengthening Families, Creating a New Normal. I'd like to take a second to dissect this. When you look at the columns starting on the left with the levers, or the levers for change there, you'll see that it talks about a cross-system approach to working with the Strengthening Families initiative and embedding these protective factors into different agencies and systems. So you see that in parent partnerships, policies and systems, and professional development. And then the Center for the Study of Social Policy came up with these strategies, the 7 strategies in the next column over, as key strategies to implement strengthening families into different systems. So as you go on across the page to the protective factors, we have families and communities that build these protective factors also promote healthy outcomes. And we have added a sixth protective factor to that. Out of social emotional competence, we have also looked at nurturing and attachment, which under the CSSP framework is part of that work there, but we've decided to break that out and put nurturing and attachment, as you saw on the previous page that Terry mentioned. And what's really unique about this effort, and I think ultimately why there's so much energy around this, is it's not only looking at the results around decreasing child abuse and neglect or child maltreatment, but it's also about this optimal child development and increasing school readiness. So as we dive down to the bottom of the page and we look at this whole idea of a paradigm shift, and really for some folks this paradigm shift will be something that's already existing in their services and agencies. For others it will be creating a new normal, as it says there. And so those 4 bullets just talk a little bit more about the values that CSSP and that we have adopted to look as we go forward into adapting this protective factors framework. We thought that this slide would be very helpful in looking at the life course trajectory, thinking about all children, starting prenatally all the way through their lifespan, and looking at protective factors versus risk factors, and thought that this did a nice job of balancing what families face and challenge. We can view oftentimes in our society, if you look at the right side, we talk about risk factors, and on the left side we talk about protective factors. On the right side with risk factors, we oftentimes talk about families that face and communities that face children living in poverty, families with a history of substance abuse, domestic violence, mental health challenges. And we oftentimes look at services that are targeted towards at-risk folks or folks families that already need these services. But as Terry had mentioned, this is really about looking at all families and also looking at the protective factors. So on the left side of the page, we really are trying to take the opportunity to look at positive change through family support and skill attainment, which is that ultimate goal at the bottom. But we're trying to move towards looking at negative vulnerability to building positive resilience. As we move forward, we thought it would be nice for you all to have a little bit more of a concept of the work in process. And so at this point, as you think about Kentucky Strengthening Families, as you think about it, it is not a program. There is a Strengthening Families program that is out there. It's not a program. This is more of a protective factor framework, and it's really an initiative that's built around a philosophy, some common agenda, common core language, that all communities, and ultimately when I say communities, agencies, both regional, state, local, can move forward in embedding these Strengthening Families protective factors. So as I mentioned earlier, we're looking at not just 5 protective factors from CSSP, but 6 protective factors. And I think the most important thing is that we take a look at conceptualizing this as we have to this point, as family is being defined as any adult caring for a child. You may hear the words as well, parents, in the rest of the presentation. Please know those are synonymous with the idea of family, and that when we talk about family, we've talked about this being inclusive of all adults caring for children, whether it's a biological parent, foster adoptive parent, grandparent or other relative, a self-defined family member, could be an educator, early care and education provider, friend or neighbor, whoever has adopted that role of caring for a child. So, what you all have been wanting to know more about is these 6 protective factors. And the 6 protective factors below, I want you, as you get a chance to look through those and read those, you might take a minute to pause the presentation and read those yourself. But I'm just going to highlight a couple quick things. One, you'll notice as you look at these that all 6 of them provide linkages or overlap with one another. We believe that all 6 of these are important to families. I think sometimes there is a sense when we've talked about this that one of these things might be more important than the other, but when we look at the research from CSSP, it's really looking at all 6 of these protective factors that can be built for families or should exist for families in our communities. And you might also say, as I look at this a little bit more deeply and I look at it in my agency or system, that my system may not be able to meet all of the needs under all 6 of these protective factors, and that that's okay. That a big piece of this work is looking at what are our gifts, both as agencies, family providers, and we may only cover 2 or 3 of these areas, but it will be the responsibility of that community, whether it's local, regional, or state, to really look at how do families access all 6 of these protective factors in their communities. As we dive into these a little bit more, parent resilience. What is resilience? And resilience is the ability to cope with everyday stresses, recover from occasional crises. What does this look like? The second bullet down, it's creating a positive attitude, creatively problem solving, and trying to effectively address challenges. And one of the results, really 2 of the results, the next 2 bullets, that we like to think about when we're conceptualizing parent resilience is that at the end of the day, when parents have this resilience, they're less likely to direct their anger and frustration at children. And as we look at their strengths, they are able to build a better awareness of their own challenges and seek support when needed. Having said that, as we're talking about early care and education providers and looking at community early childhood councils, what can you do and what can you promote? A piece of that work might, to better conceptualize this, would be looking at becoming more welcoming and supportive in our programs. Helping families work to develop family goals would be an example of that. Restructuring or making sure that your structure includes pick-up and drop-off opportunities, one-on-one, as well as the opportunity to involve families in their decisions about their children. Having said that, moving on to the second protective factor in this order, social connections. This is very important because we look at families and we say, what sort of emotional support do they have? What friends, families, neighbors, and others in their community can help them? And that may look like a positive peer network. It may be talking about mutual support systems, other community connections. But we know when families have the willingness and permission to reach out to others that they can get their needs met. This doesn't mean, though, that they have lots and lots of friends. For some folks, that may mean that they just have the appropriate amount. It may be a few numbers of friends and other partners in their community that they can turn to ask for help. And it's also about the perception. So that 4th bullet down talks about this addresses social isolation and the perceived lack of support that can be key risk factors to child maltreatment. So how do we do this in early care and education settings? We make spaces for families to meet informally. We make opportunities for having family field trips with their children so that family members can get to meet other family members. We can look at arranging parent or family leadership programs and events that should be created for families and be planned with families, and it shouldn't be something that's done for families, so they should be a part of that planning process. And it may also be looking at things like the informal work that families do in creating Facebook pages and Twitter and other ways to share information amongst one another and have social connections. So the third is knowledge of parenting and child development. We're trying to help families help their children grow and learn. And so as we look at this one, we want children to live up to their full potential, but we know that the most important thing that families have access to is accurate information about raising their children and understanding appropriate expectations for children's behavior. And we know that if we don't have those things in families, that this often can be associated with the risk for child maltreatment. We also know that this can happen in different ways. It can be through mentoring, coaching, advice, It can happen in more informal settings than just having a traditional parenting class. So how do we do that in early care and education settings beyond just parent classes? It may include conducting home visits or restructuring your program to see if you can visit the home. It may be looking at beyond the take-home sheets that sometimes programs use. They can utilize verbal messages to parents. And I think most importantly, just giving positive experiences, sharing positive experience to parents around developmental milestones, pointing out when children have reached a developmental milestone. And last but not least, it could also include screening resources like the Ages and Stages questionnaire built into your program to help parents and providers have a common language to talk about where that child's development is at. The fourth one, concrete support in times of need. This is looking and goes beyond just the typical human service provider agencies. We talk about this being trusted, reliable, and easy access to both emotional and basic supports, so food, clothing, shelter, transportation. But it also is those looking to those more non-traditional services, things like faith-based services, some nonprofits that do more non-traditional work, or even informal support networks that may be able to provide for some of these concrete needs. And it is inclusive of things that include emotional support, things like connecting to the appropriate services, domestic violence, substance abuse counseling, mental health services, to be proactive for families and promote that those are okay things to seek services for. So how do we go about building that? We build that through relationships with families so that they feel more comfortable sharing challenges, make space for staff to meet privately with families, responding when there are issues or warning signs in an appropriate manner, and being connected as early care providers to other services and organizations, and knowing what's out there in your local communities for children. So the fifth is social emotional competence of children. As we look at this, probably the most important thing, thinking about school readiness, is that when you ask most kindergarten teachers, would they rather have a child who does not know their colors, numbers, shapes, being able to write their name, those sorts of more traditional academic skills, versus whether they have a child who has the inability to regulate their emotions or socially interact with others and other social emotional competencies. Most teachers will tell you, I'd much rather have a child who has those abilities, those social emotional competencies, and lacks some of the academic than the inverse of that, because the inverse of that, if they don't have the social emotional competency, it's very difficult to catch up on that, and it's very difficult to remediate for those skills that have not occurred up to that point in life. And we know that all kids, when they have some of those more traditional deficits, that usually by third grade we see that they're right along track with their appropriate peers. So how do we go about doing this? We encourage interactions, we encourage friendships, and a lot of it's about building executive functions, things like cognitive flexibility, impulse control, and working memory. So in an early care and education setting, this could be done with helping families to understand these as part of child development, to encourage children to express feelings through words, artwork, expressive play. If you're talking about infants, it may be more about nurturing and attachment activities and showing that feedback that can happen in those relationships. It can be about providing individualized support, and it can also be looking at social emotional curricula or social emotional learning curriculum, such as second step curriculum or the Incredible Years program, or other such curriculums that may help with positive behavioral supports in early care and education settings. So lastly, but not leastly certainly, is nurturing and detachment. And we broke this one out so that we could focus directly on that relationship between the parent and ultimately that caregiver and the child, because we know that it's the core feature to optimal brain development, and that this attachment is about that serve and return between children and that adult. And if children don't have this, that it can be very detrimental, and probably the most detrimental thing to further development if they don't have these relationship aspects met at a very early age, even starting prenatally, but certainly in the first few years of life. So how do early childhood programs encourage this? They do that very well in encouraging parent-child interactions in infant-toddler rooms. There's the opportunity to model that to parents in the way that the environment's set up, as well as offering other outside activities around parent education and skill building to provide attachment opportunities. So having said that, you will see this list of 7 strategies that support the development of protective factors. These are that list from the Center for the Study of Social Policy. These are all key features to be thinking about in doing that. And I think what's most important is probably this paradigm shift. And where I'd like to end with my portion of the this training or webinar is to look at this paradigm shift. We're looking at shifting our focus from at-risk families to looking at all families need support at times. Instead of just looking at risk factors or overcoming those risk factors, we know now, and we've known for a long time with the research, that protective factors can help buffer for toxic stress and can be a very cost-effective way to helping young children and families get their needs met. We also know that moving from a deficit-based model, looking at the challenges that a child has, oftentimes when we focus on challenges, sometimes we create new challenges versus looking at the strength-based perspective, and we love the fact that this is a strength-based initiative. We also talk about blaming families sometimes, or family inadequacies, and whether we intentionally mean to do so with our language or how we work with families, or behind the scenes, how we categorize families when we're frustrated, we can get into a role of blaming. And so we're trying to move from that role of blaming to really talking about we all have skills that we need to build, and families need opportunities to build those skills as well. And that is certainly a continuum and an ongoing continuum that we need to start nurturing early in life and keep going through older ages. And the last there around prevention is that we know that strong families raise strong children, so our work will be to support them. Terry, I will let you move on to the next slide, and thank you very much for your time.
Thanks so much, Tal, for that informative kind of fast trip through the protective factors, and I think it was so helpful to have the examples of what kinds of things programs that interact with families might do to promote those protective factors. So just kind of in wrapping up, our goals for strengthening families in Kentucky is to really unify the early childhood education, health and development, child welfare, family support, and other programs, both state and community-based, to promote a strength-based approach to working with families. So we'll be looking to the future to use the Strengthening Families framework to guide policy and decision-making in programs of all kinds that interact with families, really embedding that framework into the systems that serve families with young children, not only at the state level, but with community-based services, both public and private. So our goal is to build communities including business leaders, elected officials, community early childhood councils, as well as programs that serve families to help build protective factors in all families. There are a number of resources you can pursue to learn lots more about strengthening families, the primary one being the Center for the Study of Social Policy's website that you see on the screen, and the National Alliance of Trust and Prevention Funds. There, as I mentioned earlier, are well-developed implementation plans for some kinds of programs and also examples from other states. And here again is another resource. This one is an online training, 7 modules total, and it's available free of charge to you if you would like to really take a deep dive into strengthening families. And coming soon in the state, we are beginning, including with this Community Early Childhood Council webinar, to increase awareness about the Strengthening Families Framework. We will just in a short month or two begin actually rolling out a training plan to train folks in programs that serve families about the Strengthening Families Framework and the 6 protective factors. Our goal, of course, is adoption across all programs, and also to engage community early childhood councils as local conveners of groups that represent all of the partners in strengthening families at the state level. So expect to hear a lot more about strengthening families in the coming weeks, months, and years probably, as we get fully engaged in rolling it out to every community in the state. And especially expect to hear a lot more about strengthening families in June at our Ready Kids Conference. Strengthening families will be one of the major themes that we'll build that learning opportunity around. And so please plan to join us and encourage others to join us June 16th to 18th at the Galt House in Louisville. If you have not already done so, go to our website to sign up to make sure that you get future notices about the Ready Kids Conference. Looking forward to seeing you in June. Thank you again for joining us today. We think Strengthening Families presents an exciting opportunity for all of us to focus on building strong families who can, in turn, help raise strong and resilient kids. Thanks for joining us.
Thank you, Terry, and thank you, Tal, for teaching us a little bit more about the Strengthening Families Framework. And as Terry said, we will continue this conversation throughout the year. I know that most of us here at the state level are really excited about some of the opportunities that Strengthening Families provides to us. So, again, thank you guys for joining us, and we will see you next month.